In this video, I want to explain how this, a balloon, could be the thing you're missing to get out of constant headaches, neck pain, and shoulder pain. If you're new here, welcome. My name is Dr. Brian Larish. I am a physical therapist and strength coach that helps people both in person and virtually around the world. Like I previously said, if you're dealing with any of those issues and you haven't audited your breathing, then this is the video for you. Let's first talk about what's going on as far as why we have these dysfunctions, what's the root cause of it, and how a balloon can actually help. The first thing we need to understand is that a rigid rib cage equals dysfunction. When we have a rib cage that can't expand when we breathe, we're going to have to compensate. People will compensate by overusing their necks, people will compensate by belly breathing, people will even compensate by shifting their center of mass forwards, all of these things so we can do the one thing that we do 23,000 times per day, which is breathe. And to be honest, if you think of a hierarchy, do you think your brain really cares about neck pain, headaches, shoulder pain if the strategies you're using cause that, but it helps you breathe? I'd say breathing is probably on the top of the hierarchy and all these other things are at the bottom. So what happens? We have so much compression from tissues being stiff. You could think of it as tight, but really they're getting compressed. And really it's from our posture. When we shift forwards, things compress. But I digress, that's for a different video. What you need to think about is this rigidity is going to create a scenario where we can only breathe through our belly. Here's how air works. It's like a lazy person. It's going to find and seek out the path of least resistance. So if we have a ton of compression front to back, compression side to side, there is very little resistance here at the stomach. And this is why most people, when they take a big inhale through their nose, we don't expand here, we only expand the stomach. Now, how does that start to create all those dysfunctions we talked about? Well, the body still needs to try to elevate and expand the ribs. The lungs in the chest cavity here still need to try to expand. And so we start to run in a scenario where a lot of these neck muscles have to overwork 23,000 times per day to try and pull the rib cage up instead of air actually expanding it front to back. If that's hard to understand, think of this. If I asked you to do 23,000 terrible squats every single day, you would probably expect that you would have some sort of ache or pain. This is the same thing. When we can't breathe effectively, aka when we can't use our diaphragm, which sits at the border of the lower rib cage, when we can't use it and actually expand, then things have to compensate. And we get a lot of the dysfunctions that we see. And really it becomes this vicious cycle where we start to squeeze ourselves more and more and more. This is why if you have these dysfunctions, just doing a shoulder stretch or a pec stretch or a neck stretch, it doesn't really do anything long term. Think of it. If you just did this neck stretch, like a side bend, but then you still go back to your 23,000 dysfunctional breaths where the neck is having to work, we just go back to where we came from. So we need to attack the root cause. This is where a balloon can come in. A balloon is just like a dumbbell for your abs. What it's going to do is help create resistance, just like a dumbbell would, so we can start to create some movement of the rib cage. When we actually bring the ribs down, we then set ourselves up where we can actually start to take an inhale that expands front to back and expands the chest. When we can get the chest expanding more, we don't need the neck trying to pull the ribs up because the air did that job. So let's go to the floor and talk step by step how we can use a balloon. If you have a balloon, grab it. If you don't have a balloon, that's fine. You just need to take a balloon breath. A balloon breath will be a much stronger exhale compared to if you didn't have a balloon. So let's start in a hook lying position. And first, let's do it without a balloon. That way you can use your hands to start to visualize and understand. What you're gonna want to do is place one hand on the stomach or around the belly button and one hand on the chest. First, do a pre-test. Take an inhale through your nose. Take an exhale through your mouth. And which hands were moving? Was it 90% belly? Was it 10% chest? Or are you actually getting some chest motion? So we need to understand where we are starting from. Once you understand where you're starting from, we're going to want to get a little bit more of an expansion or an opening up on the inhale from the chest. And then as we exhale, we want to feel the top hand go down and then the bottom hand go down. So this is how it looks. Hands on the belly button and the chest. Take an inhale through your nose. Think of the first breath as being free. Exhale through your mouth until you feel the ribs go down. Hold on to that tension. You should feel some tension, hold on to it, and take an inhale without your stomach rising. And then take our next exhale and try to get the ribs to move even further down. Notice how I'm saying move the ribs. If you exhale and they don't move down, you need to keep on exhaling. We have more air in us than we think. Keep exhaling, and if you're struggling, that's where the balloon comes in. So we want to see these sequence of events as the exhale brings the ribs down. We then hold on, maintain that position, inhale and feel the chest rise. Then repeat, exhale, try to get the ribs to go down more. If you do this right, you should start to feel some abs kick in because they are eccentrically holding on to that tension. So now when you bring the balloon in, your exhale becomes a lot easier. So I'd put one hand on the lower rib cage to feel it, one hand with the balloon. Take your balloon breath. You should feel the ribs go down because we created resistance. Hold on to that tension. Inhale, feel your chest rise. And then repeat. How you know if you're getting enough air is if you take 4 breaths, you want to have a party-ready balloon. So would you feel confident putting a balloon up when you take 4 breaths if you were doing so for a party? If not, we need to get more air out. So this is a great starting point if you have any of those dysfunctions, but when you do the breathing exercises, you shouldn't feel that. You shouldn't feel your neck, you shouldn't have a headache, you shouldn't feel tension in those places that are bothering you. All this should be pretty effortless. There's going to be a little bit more effort with the balloon, but we want to feel and sense that movement of the ribs on the way down and the expansion on the way up.